Step 2 is to observe the child in a comfortable, relaxed setting. Allow the child to play naturally and watch the play skills and the child's interactions with the parents or other persons in the setting. Take careful notes of the behaviors you observe and do not attempt to interact during this step. Be relaxed with the child and the family as you further build rapport with the child in this unobtrusive way. Once the observation has been completed, enter all additional scores per your observation in the assessment log. You will find that you can score many more items from this step. Step 3 is the directed assessment, when you will complete the assessment for any items not scored during the interview or observation. Following the procedures listed in the manual, assess all unscored sequences that are developmentally appropriate for the child. Use materials familiar to the child whenever possible. Only use items you bring when similar items are not already available. When assessing items, you will establish a basal and ceiling for each sequence. A detailed explanation about how to do this is given on the next two screens. After the assessment is completed, check all of your scoring notations to be sure that every item has a score before proceeding to step 4. Generally, a CCITSN can be completed in 60 to 90 minutes, depending on the child's age and attention span. It may be given over several sessions. Each item assessed should be scored as mastered plus, not demonstrated minus, or emerging or inconsistent plus minus. If a child has severe motor impairments, add an A to scores of plus or plus minus to indicate if physical assistance was given. You must establish a basal and ceiling for each sequence that is assessed. To do so, start assessing items at the child's perceived developmental age for that sequence. If the child receives a score of plus for all items in the age interval in which you started, that is, the child has mastered all the items in that age interval, continue to assess items at the next higher age interval. If the child does not score a plus for all items in the age interval, assess items at a lower age interval in that sequence until the child receives a plus for all items within the age interval. Now you have established the basal. Then continue assessing at higher age intervals until the child scores a minus for all items within the higher age interval. This is the ceiling. Here is an example. Turn to Curriculum Sequence 1, Self-Regulation and Responsibility, in your assessment log. Let's assume the child meets criteria, scores a plus for items G and H, the 12 to 15-month age interval. This is the basal. The child also scores a plus for item I, but scores a plus-minus emerging skill for items J, K, and L. Then the child gets a minus for items M and N, 24 to 30-month interval. This is the ceiling. At this point, the assessor can stop assessing items in the sequence. Now all items at age younger than 12 to 15 months, the basal, can be scored as met, a plus for the sequence, and all items older than 24 to 30 months, the ceiling, can be scored as not met, a minus for the sequence. Step 4 is to complete the developmental progress chart, which is found on the last 2 pages of the assessment log. This is an important last step to provide a graphic of the child's current skills. Complete the chart by entering the date of the assessment and the color to be used. Use a different colored pencil or highlighter to record each separate assessment. The next slide illustrates the recording method. This slide illustrates the scoring procedure for the developmental progress chart. As you can see, for items that are met and scored plus, the square is filled in completely. Items that are emerging, plus minus, are filled in partially. Items that have not been met at all are left blank. Be sure to fill in every met and emerging item and enter scores for every curriculum sequence within the child's functioning range. You will note that some sequences don't begin until later ages, such as Sequence 9, Number Concepts, and some start at birth and are completed before 36 months, such as Sequence 24, Prone. Note that this developmental progress chart shows the results of 2 different assessment periods for this child, as indicated by the 2 different colors. The chart shows the approximate developmental age for the child in each sequence and domain but cannot yield standardized scores, since the CCITSN is a criterion referenced assessment tool.